Welcome to the deep dive. You've said this your sources, and today we're looking into something really common for anyone with pets. We're talking about those benign fatty lumps and bumps lipomas, specifically in dogs and cats.
Right, those little growths lots of owners notice.
Exactly. And you're clearly looking to understand them better. So our mission today is pretty straightforward. Let's dive deep into what they are, why pets get them, how vets diagnose them, and what it all really means for you, the pet owner. And we're basing this entirely on the material you shared with us.
Okay, let's unpack this then. So, fundamentally, lipomas are benign tumors. Think of them as just collections of mature fat cells. Adipocytes is the technical term. And crucially, these cells look, well, identical to normal fat cells.
So benign is the key word there, not cancer.
Precisely. That's the most important takeaway right at the start. Benign means they don't have those abnormal cells, and they don't spread or invade other tissues like malignant tumors do.
Right, like a little contained pouch of normal fat cells that just grew a bit too much.
Got it. So how common are we talking? It feels like you hear about them a lot.
Yeah, they are quite common. The reported numbers, based on your sources, are around 16% of dogs and maybe 12% of cats developing them. But, and this is interesting, the actual number is probably higher.
Higher. Why is that?
Well, because many are diagnosed just by feel, you know? During a vet checkup, the vet feels a soft lump, says looks like a lipoma, and maybe no further tests are done.
Ah, I see. So that casual diagnosis means many might not get officially recorded in those stats. Makes sense.
Exactly. So that lump you might have felt, the one your vet wasn't too worried about, probably more frequent than the official figures show.
Okay. And where do these tend to pop up on our pets?
The usual spots are just under the skin's subcutaneous tissue. So think chest, abdomen, down the legs, and sort of in the armpit area, the axillate.
Right, the soft, movable ones you can feel easily. Yes. But it gets a bit more interesting. They aren't only found there. Although it's less common, they've also been reported inside the chest or the abdomen.
Inside, wow.
Yeah, even in the uterus. Around the eye socket, the orbit. And believe it or not, sometimes within bone.
In bone. Fat cells growing in bone. That sounds unusual.
It does, doesn't it? It really highlights how sometimes the body's normal growth signals can get a little, well, confused, even for benign things.
Definitely unexpected. So they can show up almost anywhere, theoretically. Are certain pets more likely to get them?
There do seem to be some trends looking at the sources. In dogs, definitely more common in middle-aged to older dogs. And interestingly, quite rare in cats overall.
Okay, so more of a dog thing, especially older dogs. Any specific breeds?
While there isn't one single breed overwhelmingly affected, some seem to have a higher risk reported. Your sources mention Labs, Dobermans, miniature Schnauzers, Cocker Spaniels, Dachshunds, and Weimaraners.
Quite a mix there.
It does make you wonder, doesn't it, if there's some underlying genetic predisposition in those breeds.
Yeah, absolutely. What about other factors, like weight?
The information suggests that overweight dogs might be more prone. It's not a definite link, but a possibility. And female dogs also seem to have a slight predisposition.
Okay, so older, maybe a bit overweight, female dogs of certain breeds might be the most likely candidates. What about cats, though? You said rare, but any trends there?
For cats, the data hints they might pop up a bit more often in neutered males. It's less clear-cut than in dogs, but it's a detail mentioned.
Interesting. Okay, so if you find a lump, what's the typical feel? What should you, the owner, look out for?
Well, usually it's a single lump, but it's definitely not uncommon for a pet to have several.
Right, multiple bumps.
Yeah. They vary in size, often roundish, and a key thing is they tend to grow slowly. You don't usually see them appear overnight.
Slow growth, okay. And how do they feel?
Often soft, kind of squishy, and you can often move them around a bit under the skin. But, and this is really important, sometimes lipomas grow between muscle layers. We call those intermuscular lipomas.
Between the muscle.
Exactly. Common in the back of the thigh, for instance. And these can feel quite firm.
Ah, okay. So firmness doesn't automatically mean it's something bad.
Correct. That firmness can sometimes make owners, or even vets initially, worry about something more serious, but it could still just be a lipoma in a deeper spot.
That's really good to know. So besides feeling the lump itself, are there other signs? Does it bother the pet?
Often, no. And that's the good news. Most pets with lipomas are totally asymptomatic. They act normally. The only time they usually cause issues is if they get really large, or if they're located somewhere awkward, like near a joint, where they might interfere with movement.
Okay.
And because they grow by just expanding, sort of pushing things aside rather than invading, those internal ones we mentioned could potentially press on organs if they get big enough.
I see. And you mentioned they can be there for a while before being noticed?
Yes. The sources say they might be present for a year or even more before the owner decides to get it checked out by the vet.
Right. So slow growing, usually soft, often don't cause problems. That seems to be the general picture. Now, the big question, why? What actually causes them?
And that's the million-dollar question, isn't it? The sources are very clear. The exact cause is unknown.
Huh. Frustrating. So no clear why. Oh, wait, but moving on to diagnosis then. If you find a lump, how does the vet figure out for sure it's a benign lipoma and not something, worse?
Right, the diagnostic process. First, the vet considers what else it could be, the differential diagnosis. They're thinking, could it be an infiltrative lipoma? Still benign fat, but a bit more locally aggressive, harder to remove. Or, more concerningly, could it be a malignant tumor like a liposarcoma or some other soft tissue sarcoma?
Okay, so they need to rule out the serious stuff. What tests help?
Standard blood tests and urine tests are usually completely normal with a simple lipoma. That helps rule out other illnesses. Imaging can help too. X-rays might show a mass that looks like fat density. CT or MRI scans are even better at clearly identifying fatty tissue.
So imaging gives clues, but is there a more direct way to know what the cells are?
Absolutely. The key test, usually the first step, is a fine needle aspiration. FNA for short.
Needle test.
Yep. Stick a small needle in, suck out some cells, and look at them under a microscope. Ideally, you see normal, mature fat cells. There's a small catch, though. Fat is greasy, right? So it tends to wash off the slide during preparation. Sometimes you end up with a sample that doesn't have many cells left to look at.
Ah, so it might not give a clear answer sometimes?
It can sometimes be inconclusive, yes.
Yeah.
Which is why the gold standard for a really definitive answer is a biopsy.
Taking a bigger piece.
Exactly. A small chunk of the tissue sent to a pathologist. They look at the structure, how the cells are arranged. They confirm it's just normal fat tissue. Sometimes they might see other benign things mixed in, like a bit of cartilage or blood vessels or fibrous tissue that gives names like chondrolipoma or fibrolipoma, but it doesn't usually change the fact that it's benign. And crucially, the pathologist looks to see if there's any sign of the cells invading the surrounding tissue. That's key for ruling out malignancy or even that infiltrative type.
Right, so the biopsy gives the full picture. Okay, let's say the diagnosis is confirmed, just a regular lipoma. What happens next? Do they always need treatment?
Not always. Since they're benign and often don't cause problems, watchful waiting is sometimes the approach. But if it is causing issues like bothering the pet, hindering movement, getting really big, or if it's pressing on something internally, then surgery is the way to go.
Surgery to remove it.
Yes. And surgical removal is generally curative because they're usually nicely contained and encapsulated, like little fatty balloons.
Easy to scoop out, hopefully.
Often, yes. Even those trickier intermuscular ones, the ones between the muscles, can usually be removed successfully with careful surgery.
Okay. Any other treatments mentioned?
Liposuction was mentioned for smaller ones, but apparently they have a higher chance of growing back with that method. And there's mention of a newer approach, injecting a steroid, triamcinolone acetonide, directly into the lipoma. Your sources say this has shown some success, even causing complete regression in some cases.
Injecting it to shrink it. Interesting. What about pills or medications? Anything like that?
Generally, no. Medical therapy is usually considered unnecessary, and according to the sources, pretty ineffective for these simple lipomas. It's just an overgrowth of normal cells.
Right, makes sense. So if it's removed or if you just monitor it, what's the follow-up like?
The main thing is just for you, the owner, to keep an eye on the area. Recurrence after complete removal is rare, but possible. If it does come back, another surgery can often sort it out. However, the sources make a good point. If a lump does reappear, especially if it seems different, maybe growing faster, then the vet needs to reconsider if it might be something more serious this time.
Good point. Always reassess if things change. Okay, we don't know the exact cause, but can we do anything to prevent them?
Sadly, not really. There are no specific preventative measures identified. The only potential link mentioned is obesity.
The weight factor again.
Yeah, so maybe, just maybe, keeping your pet at a healthy weight could reduce the risk slightly. But mostly, it seems like if they're going to get them, they get them.
Okay, so maintaining a healthy weight is just good general advice anyway. So putting it all together, what's the overall outlook for a pet with a lipoma?
Generally, very good. Excellent, really. Cure is expected if it's surgically removed completely. If removal isn't complete, sure, it might recur. And removing them earlier is often better if they're in a spot where they could cause problems later.
Like near a joint.
Exactly. And it's also worth remembering, a pet that gets one lipoma might develop others in different spots later in life. That's pretty common too.
And those other elements sometimes found inside, like cartilage, doesn't change the good outlook.
No, those are generally rare findings and don't typically affect the outcome. Still benign, still usually cured with surgery if needed.
Okay, so let's sum this up. Lipomas, super common, especially in older dogs. They're basically benign fatty lumps,
That's right. Usually harmless.
but their size and location can sometimes cause issues. So getting a proper diagnosis from your vet is important just to be sure it's not something more serious.
Absolutely crucial.
And if you, the listener, notice any new lump or bump on your pet, don't hesitate, get it checked out. Better safe than sorry.
Always the best advice. And, it does make you think, given how incredibly common these are, these non-cancerous growths,
Yeah.
particularly in certain breeds as they age, what are the underlying biological switches being flipped, or not flipped, that allow this focused overgrowth of fat cells? Could digging deeper into that eventually lead to preventative strategies beyond just, watching their weight?
That's a really interesting thought. What's going on at a deeper level? Definitely something to ponder.